Thank you for returning to Oi Chung channel. This is Angela Oi Chung. I am going to talk about a little monster that lives in human stomachs. What is H. pylori? Helicobacter pylori, H. pylori, is a bacteria that lives in human stomachs. It is a spiral-shaped bacterium with several unique features that allow it to survive in the stomach's acidic environment. The bacteria can cause inflammation in the stomach lining, leading to gastrointestinal problems, including peptic ulcers, gastritis, and even stomach cancer. H. pylori is usually spread from person to person through contaminated food, water, or utensils and can be treated with antibiotics and other medications. What is the global prevalence rate? The global prevalence of H. pylori infection is approximately 50% of the world's population is estimated to be infected with H. pylori. The infection is more common in developing countries, particularly in parts of Asia, Africa, and South America, where prevalence rates can be as high as 80 to 90%. In developed countries, such as the United States and Western Europe, the prevalence of H. pylori infection is generally lower but still significant, with rates ranging from 20 to 50% depending on the population studied. It is important to note that while H. pylori infection is common, not all infected individuals will develop symptoms or complications, and many may be asymptomatic carriers of the bacteria. What are the symptoms of H. pylori infection? H. pylori infection symptoms can vary widely and range from mild to severe. The most common symptoms include abdominal pain, bloating, nausea, and vomiting. Additionally, some people may experience loss of appetite, weight loss, and fatigue. These symptoms can be mistaken for other gastrointestinal conditions, so diagnostic testing is necessary to confirm H. pylori infection. It's important to note that not everyone infected with H. pylori will experience symptoms, and some may be asymptomatic carriers of the bacteria. If you suspect that you or your patient may have H. pylori infection, it's important to consult with a healthcare professional for the appropriate evaluation and treatment. Don't hesitate to contact a healthcare professional if you have any concerns. What are the diagnostic methods? Several diagnostic methods are available to confirm the presence of H. pylori infection. One of the most common methods is a non-invasive test, which may involve a breath, stool antigen, or blood test. During an endoscopy, a small tissue sample is taken from the stomach lining and examined for H. pylori bacteria. What are the treatment options? H. pylori infection typically involves a combination of antibiotics and acid suppression medication. The antibiotic regimen usually consists of a proton pump inhibitor, PPI, plus 2 or 3 antibiotics, such as amoxicillin, clarithromycin, metronidazole, or tetracycline. The duration of treatment varies depending on the specific regimen used but typically lasts 14 days. The goal of treatment is to eradicate the H. pylori infection and heal any damage that has been done to the stomach lining. It is important to follow the recommended treatment regimen exactly as prescribed, as incomplete treatment or failure to adhere to it can lead to treatment failure and increased risk of complications. What is the follow-up? Follow-up after H. pylori treatment is important to ensure the eradication of the infection and monitor for any potential complications. Follow-up testing is recommended approximately 4 weeks after treatment completion to confirm the bacteria's eradication. This can be done using a non-invasive test, such as a urea breath test or stool antigen test. In addition, patients should be advised to report any ongoing symptoms or the development of new symptoms, as this may indicate treatment failure or the presence of other gastrointestinal conditions. Long-term follow-up may also be recommended for patients with a history of peptic ulcers or gastric cancer, as these conditions require more frequent monitoring. What is prevention? H. pylori infection is an important public health issue. The bacteria can lead to various gastrointestinal problems, including peptic ulcers and stomach cancer. While it is difficult to prevent H. pylori infection completely, some measures can help reduce the risk of infection. These may include practicing good hygiene, such as washing hands thoroughly before eating, avoiding sharing utensils or drinking glasses with others, and drinking clean water. In addition, patients should be advised to avoid consuming raw or undercooked meat or seafood, which may be contaminated with bacteria. While these measures may not completely prevent H. pylori infection, they can help reduce the risk of transmission and promote overall health and well-being. What is the complication? Untreated or undertreated H. pylori infection can lead to complications, including peptic ulcers, gastritis, and stomach cancer. In addition, H. pylori infection has been associated with an increased risk of certain conditions, such as gastroesophageal reflux disease, GERD, and autoimmune atrophic gastritis. Peptic ulcers can cause pain and discomfort in the abdomen and may also lead to complications such as bleeding or perforation. Gastritis, or stomach lining inflammation, can lead to nausea, vomiting, and abdominal pain. Stomach cancer, while relatively rare, is a serious condition that can be life-threatening if not detected and treated early. It is important for patients with H. pylori infection to receive prompt and appropriate treatment to minimize the risk of these complications. Patients with a history of H. pylori infection or related complications may require long-term monitoring and follow-up to ensure early detection and treatment of potential problems. Summary: a bacterial infection that affects around 50% of the world's population. Remember, H. pylori can cause peptic ulcer disease, gastric cancer, and other health issues. Early and appropriate treatment is necessary. Completing the course of treatment is important, and follow-up also is a must to confirm any resistance to medication. This is Angela Oi Chung. You can visit me at Pacific Vistas Telehealth, www.pvtelehealth.com. Thank you for watching my video. Please let me know if you learned something about H. pylori. Please share and subscribe to my channel. See you next time.